There's not much out there for these kids. So when we opened it and have the impact that we have on the families has been phenomenal.
These are some of the more visual aids they might give to the kids in this specific program. When I'm feeling angry or mad, what are my coping skills? Our daughter, being on the autism spectrum, she's higher functioning, that added to the difficulty for us to find a program that was a good fit. That just tells me how important that diagnosis with the autism and anxiety or OCD, and in our case also depression, must be difficult to sift out or to treat or to recognize.
One of the unique things about dealing with kids who are on the spectrum but also have other mental health disorders is it can be difficult to determine what's autism and what's depression or anxiety. And for a lot of clinicians, they don't get any training in how to deal with that, to know which one is which and how to deal with the other. So if you have clinicians who are very well trained in treating children with autism but don't know anything about treating anxiety and depression, they get stuck. And they get very frustrated, and it's very easy to get hopeless as providers and families. So to be able to come together and do this makes a phenomenal impact on families' lives.
I don't have the flexibility to be here all the time, so I'm going back and forth. And she talked to me on the phone for almost an hour. She hates to talk on the phone. And it was like a different child. And I'm like, this can't be possible in a week. What is going on here? Big changes, big changes.
So it's just so special when I sit back and I think about it, how thankful they are and how much difference this place has made to their lives. It's just really still surreal sometimes, but it's special. We don't want the patients to leave here and then things go back to the way they were before. We want these to be kind of lifelong tools that they can continue to use when they discharge from here.
I am 100% sure we are not alone in this. And having sat with the other families, many people are misdiagnosed for years and they don't know. And you go there and they spot on, they know exactly what it is, and they're hardworking people and dedicated to what they're doing. And it shows. It shows, and you see it on the outcome.
It's actually not uncommon when parents come here to realize that some of the things their child is dealing with, and in fact, their way of responding to what their child is dealing with has a lot to do with things they've been dealing with for a long time.
On a personal level, I'm an adult with Asperger's, and so I knew everything that she was going through, and it literally broke my heart.
Asperger's, being on the spectrum, high-functioning autism, those weren't things people even knew about. No. You can see in pictures where he's always off for himself. He had anger issues. And so no one really had time to try to figure out what was going on.
So many times, although the child is the patient, the very act of providing treatment to the child where the parent is involved can also be extremely therapeutic to the family, as well as to the family's dynamic.
You saved my life.
Oh, well, thank you.
And to see this not only do well here in Tampa, but to see this start being replicated in our other sites at Rogers and other hospitals who aren't Rogers calling out for how can we be involved, how can we do this, we'd like to do something similar, help us. That is tremendous. To be able to raise the capacity of the very country is amazing.